Please note that the contents of this recording does not constitute medical advice. For medical advice or guidance on your health care, I encourage you to communicate with your physician, nurse practitioner, PA, or whoever else helps provide your care. November is Epilepsy Awareness Month, and today we're going to shine a light on seizures and epilepsy. When I see a patient who has had their first seizure, what I usually do is first I want to calm them down because usually it's a scary experience, something that's never happened to you before. I think oftentimes people think of seizures as something that happens to babies or children, and they might be surprised that they're in their 20s and they start having a seizure. But in reality, seizures can happen anywhere from birth all the way to the oldest of people. In fact, the highest rates that we see of seizures are in the very young and in people who are much older. So, but it can happen across the entire lifespan. So at any age, you can have your first seizure. So I usually make that clear to any patient who has their first seizure. Next, I like to explain to them what a seizure actually is. And a seizure is typically an overactivity in the brain. It could be in one part of the brain, but sometimes it's actually happening, this overactivity is happening in the entire brain all at once. The Another way we talk about it is we might say that it's kind of like a short circuit that's happening in the brain. And so when that short circuit is occurring, so let's say the part of your brain that's having that short circuit or that overactivity is the part that controls the right side of your face. And so what you might notice is that right side of the face might actually start to twitch. Let's say it's the part of the brain that controls your right arm that's having that seizure or that short circuit. Then you'll see your right arm might start having that twitching movement. When it gets a little bit more tricky is, let's say, the part of your brain that controls your memory. There's an area of the brain that's called the hippocampus. And when the hippocampus is the place where that short circuit is taking place, what you might actually experience, or what the person might actually experience, is a déjà vu. Déjà vu is a false memory where you actually are experiencing this memory, but it's not something that actually happened to you. In fact, a lot of times the person will say they experienced a déjà vu and then they actually don't remember what the actual thing was. All they could tell you is that it just felt familiar. And sometimes people have a little bit of a rising sensation in their belly. They can have all types of sensations. And again, whatever that part of the brain does, that's typically what the person will experience. Sometimes that seizure will spread from one part of the brain to another. So let's say the part of the brain that controls the right face is having the seizure. It might then spread from the face to the arm area. So now you see the face twitching, then it goes to arm twitching, then I go to leg twitching. And then in many instances, we'll see it cross over to the other side of the brain. And all of a sudden, the entire body is having a shaking movement, which we call convulsions or a generalized tonic-clonic seizures. Some people call them grand mal seizure. This is a term that patients who have been familiar with seizures for decades will often refer to them as the grand mal seizure. So that is a term that we frequently hear in our office. So after we get that understanding of what exactly that seizure is, we then going to try to talk about how are we going to find out, like why did I have that seizure, right? We want to get an MRI of the brain. Oftentimes when you have that first seizure, if you go to the emergency room, what the emergency room doctor would typically do is get a CAT scan of your brain. Because the CAT scan is very quick. They can quickly find out, is there an emergency? They can find out if that seizure was because you had a bleed in your brain or some other bad thing that was going on. So they could find out right away. And if you need a surgery or some kind of an intervention, they'll be able to find that out. Some ERs might have access to a test called an EEG, which, if you look at my tie here, these are some EEG tracings there, and they'll get that EEG to see, wow, do we still see elements of that short circuit? Do we see markers that this person is at risk for having seizures and more seizures in the future. Sometimes while you're in the emergency room, you might have another seizure. And if you happen to be on the EEG monitor, then we would actually be able to capture it, record it, and get a much better sense about what's going on, where is the seizure coming from, and then the other things that will happen if you're in the emergency room is we want to get blood tests. We want to do all kinds of testing, really get as much information as we can so we can get to the bottom of what is happening. Why am I having this seizure? Um, some people don't go to the emergency room. You might just go to your, if it's especially if it's a smaller event, the person's back to normal. A lot of times you might be going to your primary care doctor, your primary care provider. This could be a nurse practitioner, PA, a physician, and they might refer you to a specialist. And usually the specialist will want to get an MRI of your brain, really get a detailed look and see what exactly are there any little areas, are there anything that helps me figure out and gets me to understand why you have that seizure. Then we will get an EEG, and sometimes, which EEG stands for electroencephalogram, which is the brainwave test, right? Sometimes we need more than that. We might do a short EEG for like 30 minutes or so, but a lot of times we'll do longer EEG. We might put you on the EEG for overnight, 24, 48, 72 hours, get a few days of recording, as a lot of times we might not see the abnormalities unless you're sleeping. And so we get a really nice big sample of your brain waves to get a good sense of what's actually going on. And you want to really get a good therapeutic relationship with whoever is providing the care, because there's a lot of other tests that we might do. In some cases, we might get a genetic testing for you. Typically, after just one seizure, if all the tests come back normal and you've got no family history of epilepsy and nothing else from your history makes me think you're going to have another seizure, then in many cases you might not actually go on any seizure medication. But a lot of this is a discussion between you and your medical provider. I cannot tell you whether or not you should be on meds because we haven't personally met. If I do a consultation with you, I'll be glad to provide the details about whether or not you need treatment. If you have a second seizure, and we call it a second unprovoked seizure, meaning we don't see any obvious reason as to why you might have had that seizure, then usually by the second seizure, if we're pretty convinced that you've had two seizures or more seizures, usually we want to put you on anti-seizure medication. These are medications that help prevent you from having additional seizures. When we select the seizure medication, we want to go through, again, a lot of your history, get an understanding of what other medical problems you have. What other things are you concerned about? Do you have a history of depression? Do you have a history of anxiety? Do you have a history of kidney stones? All your history is so important because by knowing your history and getting a good understanding of you as the individual who's actually experiencing this new problem, it allows us to give you the best possible care. And we try to minimize the likelihood of you getting any kind of side effects. Fortunately, in this day and age, there are a large number of anti-seizure medications to choose from. So we do spend the time to get to know you, get an understanding of what is important to you. In some cases, we might talk about family planning for certain patients. If you're somebody who is able to get pregnant, we want to talk about that and find out is there a risk for any type of birth defects by taking these medications. We have a lot of experience. I've worked with a lot of potential young parents and helped guide them through pregnancies and have successful pregnancies. So yes, you can have seizures and you can still have babies. So that's just a touch of some basic information about seizures and epilepsy. Again, this is Epilepsy Awareness Month, and I did want to share one of the cool things is a patient actually gave this to me. This is I'm not going to advertise. This is a purple dragon. Purple is actually the color for seizures and epilepsy. Usually, when I come up to somebody in the hospital, if they look like they're having a seizure, a lot of times I'll go up to them and I'll say, "Remember the words purple dragon?" And and it's a way of me testing to see if they're aware, well, how's their memory working, those types of things. And then a lot of times, if I think they're in the middle of a seizure, I'll re-ask them those questions, and then they get to give a response. And one of my patients from years ago was really very grateful because of the fact that people did not know that the person was having seizures. And after identifying the seizure, after treating the seizure, and the person got really much, dramatically better, really wanted to share with me the purple dragon. And those of you who pay attention, that this is also the year of the dragon. So very special, very really just great that we can provide such amazing care to our people who are suffering from seizures. And I will leave you with, remember the words, purple dragon. See you next time.